Alors, je viens d'assister à un workshop, c'est-à-dire un atelier de travail sur la réanimation cardio-pulmonaire, CPR en anglais. Donc cet atelier organisé par le 𝗖𝗢𝗠𝗠𝗘𝗥, qui est un groupe de travail européen sur la réanimation cardio-pulmonaire. Cet atelier est organisé chaque année lors du congrès de la Société européenne de cardiologie, nous a montré aujourd'hui à tous les participants comment reconnaître un arrêt cardiaque, comment appeler les secours et commencer la réanimation pour pouvoir par la compression thoracique et aussi insuffler aux malades de ventilation qui succèdent à 30 compressions. Vous allez voir donc là, tout à l'heure, le déroulé de la prise en charge de l'arrêt cardiaque, en sachant que chaque personne doit avoir réanimé, car les victimes ne sont pas programmées. Chaque individu est susceptible de faire l'arrêt cardiaque et on sait que les témoins qui prennent en charge rapidement les patients ou la victime permettent une ressuscitation efficiente des victimes. Or, si rien n'est fait, le malade va mourir. Donc, vous allez voir comment est-ce que CPR se déroule et à la fin, nous irons dans les petites salles pour la pratique. Donc là, il y a la théorie et après, il y aura la pratique que vous verrez tout à l'heure. Mais c'est l'un des moments très intéressants que je fréquente chaque fois lors des congrès de l'ESC, car ça fait partie de ce qu'il faut faire pour sauver des vies humaines et surtout sauver des personnes qui en principe ne devraient pas mourir.
Just an introduction, my name's Ash and I'm going to be facilitating this session. Before we start, I just want to say a massive thank you to the ESC, the European Resus Council, and also the Resuscitation Council UK. I also want to say thank you to 𝗖𝗢𝗠𝗠𝗘𝗥 and 𝗓𝗑𝗓𝗠𝗓 for facilitating the training materials that we've got here today. So the purpose of our basic life support workshop is to go through the algorithm in the step-by-step process for looking at the European Resuscitation Council basic life support algorithm. So I'm going to be introducing the faculty that will be assisting us with our basic life support demo. We've got Mary and we've got Ellie and Charles as well. So Mary, I'm going to give you a bit of an 𝗖𝗢𝗠𝗠𝗘𝗥 handover about a patient on the medical ward. This is Bob. You've been asked to come and assess Bob as part of your nursing duties. You're safe to approach whenever you're ready.
Hello, good afternoon Bob. My name's Mary. Are you alright?
There's no response.
Can I start helping here please?
You've called for help and you're looking in his airway and there's nothing in his airway at all.
10 seconds, chest rise.
There's no chest rise and fall, there's no signs of life.
Can you please put out an adult emergency call?
A 2222 adult emergency call has been put out.
Bring back the defib and a back valve mask please.
Your colleague's gone to get the AED and the back valve mask.
Thank you.
At the moment your colleague's returned with a back valve mask.
Can you plug it into 15 litres on the wall? Oxygen please.
The back valve mask has been connected to 15 litres.
You use two hands and tell me when you're ready. Ready. Thank you.
Good chest rise and fall. Good chest rise and fall.
Thank you. Can we get
The
defib
AED has
back on?
started to arrive.
Thank you. Please do. 14, 15, 16, 17.
Mary and Ellie are doing a 30:2:32 ratio of chest compressions to ventilations. Charles has put the pads on and connected it to the patient's spare chest.
Unit okay. If the patient is a child, press the child button. Stop CPR. Don't touch the patient. Analyzing. Don't touch the patient. Analyzing. Shock advised. Don't touch the patient. Press the flashing shock button. Shock delivered. Start CPR.
And they're going to resume now 30:2, 30:2. Thank you very much, team. I'll stop you there. So now I'm going to talk through the process and the algorithm of the way we did things and why we did them. So looking up here at the Adult in Hospital Basic Life Support Algorithm from the European Resuscitation Council 2021 guidelines. When Mary came in, she was checking that the area was safe. She was safe to approach the patient, and she was looking to see if the patient was responsive. She's doing this by calling the patient's name, doing some verbal stimuli and some painful stimuli. There was no response to verbal or painful stimuli, and at that point she was shouting for additional help. Pulling the emergency buzzer, calling for help. She's then going to check for signs of life. She's looking in the airway to make sure the airway is clear. She's opened the airway by doing a head tilt chin lift, and is looking, listening and feeling for up to 10 seconds to see if the patient has any signs of life. At this point there were no signs of life present, and the help had arrived.
Put out an adult emergency call, please. Bring me back the AED.
While starting chest compressions, she's also giving instruction to the helper to put out an adult cardiac arrest call and to bring back the resuscitation equipment. Mary's there doing high quality chest compressions. So as you can see, chest compressions at a rate of 100 to 120 compressions in a minute, aiming for 5 to 6 centimetres depth of the patient's chest and allowing the chest to recoil. Mary's hands are positioned in the midst of the patient's chest on the sternum. Ensuring her arms are straight, her hands are locked in, she's providing high quality chest compressions. Ellie arrived back with some emergency equipment and is then providing a two-handed technique bag valve mask. She's connected this to 15 litres of oxygen. When Ellie has got a good seal with two hands, she's telling the chest compression provider they can then squeeze the bag, and you get good chest rise and fall on both of those ventilations. And we continued going through a 30 to 2, 30 to 2 until the AED arrived. Charles came in, the AED arrived. We made sure we removed any clothing and exposed the patient's bare chest. The pads were applied according to the illustration on the pads. 2 pads on our AED. We've also then, as you see, got a CPR feedback puck in the centre of the chest, and that provides real-time CPR feedback. The AED comes on, it does an immediate self-test, and then starts to analyse once the pads have been put in place. The AED says stop CPR and everyone is clear, oxygen's away. It does a quick rhythm analysis. It's reminding us not to touch the patient, analysing rhythm, and a shock has been advised. At this point in time, Charles ensures that everyone is clear and provides safe defibrillation. Shock has been delivered, and we're going to immediately resume CPR. We're going to do this for 2 minutes. In 2 minutes' time, the AED will reanalyse. This AED, like I say, has a CPR feedback, and it also has a metronome. Thank you very much. You can stop that there. Thank you, team. So what's going to happen now is we're going to split you into groups so you can practice those skills that you've just been shown.
À bientôt.